Hey everybody, welcome back to The Pathway. My name is Taylor Henrik and I'm here with my colleague, Sarang Patel.
Hey guys.
We're joined today on The Pathway by Dr. Paul Fu, the Chief Clinical Officer of Bronson Health Systems. And today we're going to be talking about neurology and intersections between neurology and psychiatry, as well as some of the specializations within neurology that Dr. Fu specializes in. So first and foremost, I just want to say welcome to Dr. Paul Fu. I hope everybody's excited to hear a little bit about Dr. Fu's life, what he's able to contribute. And first and foremost, we just wanted him to be able to introduce himself.
Yeah, good to be here. Thank you so much for this invite. So my name is Paul. I'm the Chief Clinical Officer for Bronson Medical Group. We're the largest health system in Southwest Michigan. We have about 850 employed providers. We're in about 110 locations, 4 hospitals kind of spread throughout a 3-county region. I actually grew up in Michigan. I did undergrad at University of Michigan, big Michigan football fan.
Go Blue. There you go.
Did medical school at Wayne State before spending about the last 11 years out east. I did my neurology training at Yale and then stuck out there for a little bit before coming back to the state.
Okay. Wow.
Sweet.
So you were in the Yale is Connecticut?
Yes.
Okay.
Yeah.
So you lived out that way for a couple of years?
Yeah. Yeah.
Okay. How long was your residency?
4 years for residency, and then I stayed on at Yale's faculty for 2 years. While I was doing that, I actually did my executive MBA, which is a 2-year program. It's every other weekend. So basically for 2 years, I didn't have a weekend. And I worked as a neurology attending and also got my MBA there. Yeah.
Wow.
Dang.
Did you know early on that you had a business interest on top of the healthcare interest that you had as a neurologist?
That's interesting. So I actually thought initially when I went into residency, I was going to go into clinical research. I actually joined a couple of projects. I have to say I was very bored of those projects, and I was kind of looking for career advice. We had the vice chair of the neurology department was an MD MBA. I met with him, and he said, hey, why don't you kind of spend some time with my team? He had an internal team called the Clinical Optimization Services, but they were an internal group of consultants, and they just looked at how can we improve the delivery of healthcare from one service line to another service line, one clinic to another. And it was just an amazing experience. We spent probably like 3 months to 6 months collecting data, shadowing, looking at what the current state of the clinic was, and then we would produce a book. The smallest book that we had was about 150 pages. The biggest book was 800 pages, actually. And it just kind of detailed out what the service line looked like, where we want to see it go, and then we'd also talk about the steps to take it there. And I absolutely loved it. It was an amazing experience, not only to see healthcare delivery improved for patients, but also improved for the staff and the providers. And that's after that, I kind of realized, hey, this is what I want to do for the rest of my life.
Wow. So is it safe to say that that experience as a part of that initiative informed your approach at Bronson?
Yeah, definitely. I think at Bronson, we really focused on how do we improve healthcare delivery. Access is difficult everywhere, especially in Southwest Michigan. We have very difficult access to behavioral health, but also primary care, pediatrics, women's health are all areas that we hope to improve access on. Bronson has done a really great job expanding its reach, and we have really excellent providers. But in relationship to that is also we have increased demand. And so with increasing demand, we're looking at how do we further improve healthcare delivery. And some of that is through innovation and optimization, similar to the work that I used to do.
Oh, that's wonderful. That's wonderful. Wow. Where Bronson's been in the past and where it is now, how do you juxtapose? Have you seen growth since you've joined Bronson? Or what have been some of the key initiatives that you've seen that health system prioritize while you've been a part of their leadership team?
Yeah, I think one of the things that we've really focused on, so between 2024 and now, we've actually recruited 100 providers, and so it's been fantastic. Wow. And I'm really excited. A lot of those providers could choose any health system. So there's providers that we're competing with, let's say, Duke and Cleveland Clinic and Mayo Clinic and WashU. So some of the top tier organizations kind of across the country and across the world, but we were able to bring them to Southwest Michigan. The areas of focus that we were really kind of pushing is provider engagement. How do we make sure that the providers that are part of the employed medical group feel that they have a voice and get a choice in some of the things that we're doing? We actually rolled out, we do a yearly engagement survey through Press Ganey, and we were actually told from Press Ganey that we have the highest level of participation in engagement survey that they've ever seen from an employed provider group, which is excellent. We're still waiting for the results for this year, but we're optimistic that some of the things that we're doing, including making sure that APPs have a voice in the organization, is really having success. The other thing that we're looking at is a shift towards value-based care. A lot of our contracts are shifting more towards risk-based models. And so in that setting, we're looking at how do we support the patient kind of throughout their journey. So not just in the hospital and not just in their clinics, but even when they're at home, and how do we make sure that they have access to services that are traditionally difficult to get to, such as behavioral health.
Oh, absolutely. Yeah. Absolutely. Wow. I mean, a lot of that rings true for us, especially thank you for valuing your APPs. It's always something that Sarang and I, say it lightheartedly, but it's so appreciated. The way that you've always, in our experience with you, you've always spoken highly of APPs amongst the healthcare model. And I want to always make it a point to say, I think you valued from the very top to the bottom, from your C-suite to your physicians, to your APPs, to your nurses, to your ancillary staff. It seems like Bronson has a model where everybody is valued rather than just placing emphasis on, we need the home run hitter. We need a whole team.
Right.
And it brings forth a lot of quality as you're seeing this exponential growth in your healthcare system. What are some of the early challenges that you've had in running a health system of this size?
Yeah, I think one of the things that is always a challenge is, the work that I had come from in Massachusetts. I was a CMO of a smaller medical group, and in that size, I visited every single practice in a month. I was able to do meetings face-to-face with a lot of the providers. Shifting to Bronson, it's a lot bigger organization. We're spread out across the geography. I remember one time we had to do a physician. There was a meeting that had to do on the west side of the state, and it was an hour drive from where we're headquartered in Kalamazoo. And so I think anytime you have that geographic spread across the specialties that we cover, sometimes it's a little tricky to make sure that culture is uniform and that practices are uniform. And we're always looking at bringing the best level of care across the organization. But, I think one of the true benefits, like we talked about in provider recruitment, but also it happens in the administration area and staff, is we do recruit from the best of the best. And so when you have really good people that really care about the community, that makes a huge difference. And so that makes my job easier, knowing that we have people kind of stationed across the three counties that we cover, and that they're very focused on healthcare delivery.
Absolutely. You hear the parallels. I saw Sarang nodding his head, and I did that at the same time, because there was a time when Sarang and I had, one practice, and you could devote all your time and energy to that sole practice. And it's a different feeling when you get to a point of growth where you can't be on hand every day. You have to let go of the reins. You have to trust those individuals who are in place, which we do implicitly. But you have to trust that they're carrying out your model, your visage. They're doing the things that you hope that they're doing for the clinic, for the practices, for their providers. But it's a different feeling. Just not being able to, it's not feasible for him and I to even hit all the practices in 2 days now. It would take us a week to get to all the practices, the way that we're spread out. So it's just a interesting parallel, because you have to have that same level of trust that the culture, the organization, there is uniformity while still allowing the clinics to be their own ecosystem. Everybody and all clinics operate in a different way. And I like that we allow for that, but you also have to have standardization in just how you approach certain aspects of it.
I think that's our biggest weakness right now, right? Is we have clinics obviously that are just like you guys, really well spread out. But right now, like Taylor mentioned, we struggle to get to clinics that we want to get to just on a weekly basis. We're like, hey, we want to go to the most rural clinic that we have. We want to hit there every single week. It's just not practical sometimes with the fires that come up in a business or a clinic across the board. And we're still seeing patients too, so that makes it a little bit more challenging too. What is, in your opinion, what has been helpful as far as advice to us, I think, because we still need that too, as far as what we can do better or what systems have done better to make those clinics or those locations that are farther away kind of still not feel like they're left out?
Yeah, I think there's a couple things that Bronson does really well. One is we are broken up into 11 CPCs, and within each CPC there is a dyad partnership. So we have a clinical leader as well as an administrative leader. And so in each area, we have kind of expertise both on the clinical side as well as in the budgeteering side. And in those areas, I think we really trust individuals there. Those individuals are fantastic people. There's a lot of focus. So we actually have 2 director positions open up, but there's a lot of focus on making sure a significant group of people are all interviewing and we're getting their input not only from the clinical side but from the staff side. And I think that ability to make sure that each area that you're rounding in it, but then also from your perspectives is setting a clear vision. And so what's the clear vision that you're setting? What's the culture that you want your company to be? And if that's clear and you're hiring the right people, I think that makes it an easier job.
Yeah, makes sense.
Absolutely. And then carrying forth that culture. Just so, when we bring someone on board, they may legitimately have heard about us because of the podcast, right? They may know about us for a variety of reasons. They may not know anything about us. But when we bring someone on board, we try to not oversell, but we try to sell on par and then overperform. We always want to make sure that when a provider comes on board, hey, whether it's a provider, an office manager, an administrator, administrative support staff member, whoever it might be, that they know, hey, this is what we're about. We're not going to sell you on something. We're not going to offer you something that we can't deliver on. But at the same time, we want to make sure that it's an experience that is consistent with what we sell. Mm-hmm. Otherwise, it breeds an environment for resentment or just feeling a little bit let down by a position. And the last thing that we want in healthcare is turnover amongst providers or staff. It leads to a lot of difficulties for us, as we all know.
Yeah, all the time.
And so, Dr. Fu, as we learn a little bit more about yourself, are you still practicing as a neurologist?
Yeah, so I tried to practice a little bit. I actually recently started back up a headache clinic. I don't see patients that often, but it's about every other week I have a session of headache clinic, which is actually really great. Over the last year, and starting off in my role, I hadn't done any clinical, and so it was 100% administration. But then as I kind of go back, I think it's important to remind yourself too of like the difficulty of healthcare. And so, you kind of think about standardization and how we deliver care. But as you kind of go back in the day to day, you see like, all these buttons that I have to click just to get one note done. Yeah. That gives you some appreciation for, what the providers do on a day to day basis. Yeah,
absolutely. So Dr. Fu, you said that you are taking some time starting up a headache clinic. Yep. What is a headache clinic? What does that entail?
Yeah, so neurology specialty, especially general neurology, you can see a lot of various types of disorders in neurology. So you think about stroke, seizure, myasthenia gravis, neuromuscular disorders, ALS. But actually, one of the greatest populations of patients that need to be seen are actually patients with headaches. And so actually, when I was in upstate New York, I did a general neurology clinic, and about 60% of my patients were all headache patients.
Wow.
It's actually a big issue because there's a lot of patients out there who have migraines or other types of headaches, and they have headaches so frequently that it significantly affects not only their day-to-day, but their how they plan their months. If you have 25 headaches a month, and each headache is debilitating, and so like if you have a very severe headache, you can't really do your day-to-day functions. It makes kind of life very difficult. And so there's a lot of actually new medications that are coming out just in the headache space. Patients, you can actually make a significant dent in terms of the number of headaches that they have. So I have patients that go from 25 headaches a month down to 6 headaches a month, and they are so happy. So they're happiest patients that I have, but in neurology, yeah.
That's a huge improvement. Would you, when you say headache clinic, would you blend headache and migraine, or are we just talking about different types of headaches? Both?
Yeah, so different types of headaches, and migraine being a big chunk of those, but there's other versions of headaches, including tension headache, cluster headache, and there's a little bit more complicated. I also see patients that have concussions, so usually concussions and headaches follow very closely, and so patients that have recent head injury can see me in the clinic as well.
Okay. Would you consider, is this your specialization? Or just your preferred area of treatment, or just where there's a great need?
Yeah, for us at Bronson, there's a great need. I think there's a huge population within the area. So headache is actually an area that's kind of blended with primary care, as is behavioral health. So like the primary care providers feel fairly comfortable handling some of the early headache issues. But as headache gets to be more complex and as patients tried the first or second line medications and didn't really have benefit, then they would then seek a neurologist. And so as I talked about in the general neurology field, there's actually a huge population of headache patients. And so it is in Western Michigan as well.
Absolutely.
Do you feel like migraines are getting, maybe I just hear about it more, but are they becoming more and more common? Like is the percentage of patients that have it or people that have it increasing?
Yeah, that's interesting. I think so. Just in myself, I never had headaches when I was younger, but as soon as I turned 30, I noticed headaches became more prevalent. I think kind of as a society, there's a couple things going on. One is I think there's not a lot of focus on sleep. And so I think society thinks, like you do have such busy days and you have busy evenings. There's not a lot of, hey, I need to get 7 to 8 hours of sleep at night. I think also the continued increases of uses of caffeine impacts it. And so there's studies that show that even if you drink 1 cup of coffee in the morning, the sleep that you get at night, even if you're able to fall asleep, isn't as good. So you're missing stages of sleep that you typically would be getting if you didn't have that cup of coffee. And usually then the next morning you feel really tired and you're like, hey, I really need a cup of coffee to wake up. But it was actually the cup of coffee that you drank the day before that's causing you to need the second cup of coffee. And so that is a vicious cycle. Usually patients that have very frequent intractable headaches usually have some issues with their sleep.
Interesting you say that. We joke around. I have a nightcap of coffee before I go to sleep. So I usually drink one like 20 minutes before I go to sleep. So I probably should stop that now that I think about it.
Well, and maybe you should tell them how many cups you average per day.
Yeah. Oh, yeah, for real. Yeah, I'm probably like 6 to 9.
So, Sarang, do you get headaches?
To 12. I never used to. Right now I get one like once a year, once every 6 months if I'm lucky.
He's blessed. He's very blessed. I come from a family of headache
headaches,
sufferers. Yeah. My own mom has pretty bad history of migraines, has used the CGRPs, and used to go to a clinic in Ann Arbor for migraines. So this is close to home for me. So I appreciate the work that you're doing because I've seen at its worst, like not being able to move, nausea, vomiting, not being able to drive, can't get out of bed for like hours at a time. I mean, it's awful. So when you say debilitating, I've seen a firsthand example. This isn't like a little headache. This is, feels like someone's driving an ice pick above your eye for hours at a time. And it's like, oh man, it's really, really disabling at times.
Well, we need more headache clinics. I think we have patients that we see all the time that, I mean, I don't know how to treat headaches as well as obviously most do, but after you do certain things with primary care, does Topamax, Botox, even so on and so forth.
TCAs, you name it.
It's hard to get in. So they say, they're waiting 4 to 5 months, 6 months to get in somewhere. I'm like, that's crazy. So I think that's huge that you open the headache clinic.
Well, there's definitely an intersection between that portion of neurology and psychiatry. There's no doubt about it. And you mentioned TBIs, and all the long-lasting effects of a traumatic brain injury. There's a lot of crossover, whether it be medication-based or whether it be how it affects the mental health of a client. There's no doubt about it that somebody who's a chronic headache or migraine sufferer is going to have some challenges with trying to keep their demeanor, their attitude in a place that's a little bit more conducive for their own pursuits.
So does your headache clinic, does it see all insurance types across the board?
Yes.
All ages? How does that work how does that really work for headaches?
Yeah, all ages up until, I'm an adult neurologist, so I might see kids like in 14 and above, and then pediatric neurologist takes
different
below that, yeah.
I guess, we talked about obviously expanding more towards the west side of the state too, but it'd be important to obviously be able to refer back to each other and kind of make sure that, we have a resource for patients to go to that have headaches, and especially all insurance types is a big thing that we run into all the time.
Absolutely. And it's similar to behavioral health in that I think there's a lot of long wait lists we run into, even when you're referring to, there's some big ones in the area and just saying for out of familiarity, but like Mind, M-I-N-D is a huge one. And I know that they've done good work with a lot of my clients, but in general, I think there's still the same idea as behavioral health. There's sometimes a wait list. Sometimes it's difficult to get in or insurance barriers, as is the case anywhere.
Yeah.
With trying to find the right fit. But just from both of us, we appreciate that that's an interest of yours. And for someone being a chief clinical officer and still having a foot, quote unquote, in the trenches, I just think that's so cool. I love the fact that you're still in clinic. You're right there with all of your providers You mentioned 850 providers, and there you are right with them.
Mm-hmm.
Yeah.
That's awesome. I mean, that's got to be such a, feeling shoulder to shoulder from the providers that are coming on board. Hey, he's still in the clinic with us. He's still seeing clients. I think that's awesome.
Well, I really appreciate you guys too. I mean, I think there's a lot of shared similarities between neuro and psych. One of those is shared difficulty with access. When we talk about access in behavioral health, and this is also not only in Michigan, but in Massachusetts and several other states, behavioral health access is really difficult. And we talk about, Sarang, you mentioned kind of all insurances, the ability to accept all insurances, the ability to see all ages. That's kind of unheard of in the behavioral health area.
Right.
And so even academic centers, sometimes we feel like they get maybe too picky in who they're willing to see, and there's these criteria that they set out, and that ends up limiting access to care. But I'm so impressed with what Pure Psych is doing, and how you're rolling that coverage out for all patients. And I think there's a goal for seeing patients within 7 days, and that's a very admirable thing to do.
Thank you.
Thank you. And it's not just because Dr. Fu's here, but Sarang and I have really taken it upon ourselves. My own sister lives in Kalamazoo. And so knowing what the access looks like over there, or just being familiar with the area, I'm really excited to be able to come into that area and serve a population of need. There's no doubt about it. And when you look across the state of Michigan, there are so many areas still that are so underserved as it pertains to behavioral health. But we are really excited. We hope to be able to make an impactful difference in these clients' life and offer that high quality care that we've started over here in Southeast Michigan and expand it into Southwest Michigan in the near future.